Many families are still adjusting to new schedules with back to school and trying to stay healthy. But this time of year, we also begin to approach the flu season. There are many added concerns this year with COVID-19. A local hospital is hoping to give a quick resource to break down the different symptoms. Our Emily Beyer reports.
This time of year, we start to see people fall ill with the common cold or the flu. Add COVID-19 into the mix along with seasonal allergies, and it can be difficult to recognize the different and sometimes similar symptoms folks may have.
Because it can be confusing. There's a lot of overlap in the symptoms between those common respiratory problems.
So Prevea Health has released a symptom navigator. It's a free resource that breaks down the possible symptoms someone may be experiencing in a clear and concise format.
In-person learning is incredibly valuable for children, and we want kids to be at school whenever it's safe for them to do so. Part of keeping it safe is to identify people who have COVID-19 so they're not there and spreading it. So again, having a tool that parents can use to say, hey, maybe my child has this. Maybe I need to help keep the other kids safe by keeping my child home. So let's think about going to get testing.
Dr. Thomas Huffer, the executive medical director of HSHS St. Vincent Children's Hospital in Green Bay and Prevea Health pediatrician, says he's had some parents reach out with frustration because their daycare or school has said their child needed to get tested.
Parents need to be patient with that because that's all part of the process of trying to keep the other kids there that are safe. So in other words, testing kids whenever we can to be sure that they're going to be safe and not spread it to others.
It also lists what you should do if you're experiencing certain symptoms. If you have symptoms consistent with coronavirus, experts say it's important to stay home. And like most health experts, Dr. Huffer says getting the flu shot and getting it early is important this year.
We don't know a lot about COVID-19, but one of the things that they have seen are some cases where when people got COVID-19 and influenza at the same time, they were more likely to have complications or difficulty with the COVID-19. So by getting a flu vaccine, it might be able to reduce some of those sorts of issues. The other thing is it can be difficult to tell between influenza and COVID-19. And so if we can decrease the amount of influenza out there, it just makes it easier for everybody to figure out, okay, is this influenza? Is it COVID-19? If everybody gets the flu vaccine and we really keep that decreased in our community, then it'll just make it easier as patients are coming in with respiratory illness.
Dr. Huffer adds that when children get the flu vaccine, we can see healthier communities in general.
In communities where there are higher rates of influenza vaccine given, it decreases the death rate in the elderly because the vaccine is much more effective in kids than in the elderly, and we're decreasing the spread and just making the community healthier that way.
In Green Bay, Emily Beyer, NBC 26.
All right, thanks, Em. Now, Dr. Huffer says the symptom navigator does not replace a medical diagnosis, and parents should always feel comfortable consulting with their child's doctor.